Thank you. Namaskar. Aji jo what I was very impressed with the things Suti Ayu. Suta Ayu is a Sanskrit word. How many of you know the meaning of Suta Ayu? What is the meaning of Suta? It's a Sanskrit word. And it is very apt. That's because our ancestors have actually thought about lifestyles. Suta Ayu, when you give in Sanskrit में जब आशीर्वाद दिए वो कौन कोया में आयुष्मान very good आयुष्मान Bhava. So Aisman Bhava is nothing. You want a long life, no? It's a long life, quality life, free from any disease, healthy life. That is what Dr. Suchishmita will be talking about, I think. Sutesha, that word is very good. So towards a very healthy life we all want. No? Unfortunately, earlier people used to die at a very short age. So calm age re mori jautale because the medical science was not there. Infectious disease joda thele, they were very high. Treatment है पार न चले, they used to die at a very the longevity or the life age of was almost 55-60 भीतर लोग मरी जाते थे. But now the longevity is increased. You are seeing everyone 85, 70, 69 is a very common age. Doctors को तो retire करेगा कोई दो ना till they're above 60. You work for another 5 years, 65. Now I heard from one of the doctor friend, he told they might do it 68. So our longevity has increased. With the longevity, certain problems have also arrived. Like in so what is the first thing when we tell cancer or when you hear the word cancer, what is the first thing that comes in your mind? When anyone can participate. Cancer so what is the first thing that strikes you? Huh? Huh? Death. Straight away death. You are not wrong. 30-40 years back also, when we start when the medical college when it is oncology, there is no oncology subject in our medicine. What is the 2-3 page oncology thala? Cancer हुए sorry gala se part. Alga oncology ward kichi nathala ame jebe MBBS पढ़ुथुलु से time रे. That was the rarity of cancer not discussed. Yadi cancer hala mane all India was one place, that was Tata Memorial Hospital, Mumbai, or you go to CNC Vellore. सेठी पठै परिबो नले Mumbai hospital जिवो. Why is this awareness being now? Why are we talking about cancer? Why are we talking about awareness? Awareness I'll take 5-10 minutes, then we'll go to palliative care. Why are we discussing cancer at all? It is. This is the same hall. I don't know why this auditorium. Maybe the director is very concerned about cancer. We had a seminar last month for the cancer volunteers. This hall for the cancer volunteers from the entire state. Discussion everyone is bothered, burgered and all. Everyone was saying there is a rise in the cancer. Maybe it is because of better diagnosis. Maybe the age factor has gone up. Our longevity ta body jaichi. Diagnosis factor pakhara asigaleni loko. Earlier kon Mumbai tak jai no thante. So before they go to Mumbai or they can come to any medical college or anything, they used to die like that without the diagnosis. Hey, diagnosis, body jaichi, people have become little aware about it. But then, lifestyle, madam, genetics, there is certain genes factor that is involved in this thing. Now, the cancer happened. If the awareness is there, cancer, the disease burden is so high, it is does not affect the individual. Mote cancer hala, mote malaria hala. Malaria mote kon karle? Chata botika dele, mu khaili mu bhalo hoigeli. It is not affecting the family as it is. On your family members ke effect करनी. But in a cancer patient, the family is also affected. There are many factors involved if one becomes cancer patient. One is his treatment cost. Second is his financial loss. Third is family dependency on that person. So family, social, everything gets affected. The family to बिखर जाता है. एक बार diagnosis होगा मैंने. Have you seen anyone diagnosed cancer? He is very tense. No biopsy report टा कौन आसीबो. The day needle ta gala, slide re palela, the next 3 days the whole family does not sleep. Sir will understand the fact. The waiting for the biopsy report ta kaun asibo sir, mo biopsy report. Biopsy is done for what? That is the final diagnosis of cancer. That is the gold standard. Biopsy re positive bharla, that is the final diagnosis of it. So the early awareness program, why are we telling? Aguru cancer pain treatment kichi besi nathala. गोटे नाइट्रोजन मस्टर्ड कहते मेथोट्रेक्सेट कहते किसी ट्रीटमेंट पे बेसी नहीं. सो लाइक ही टोल्ड कि कैंसर माने It is not now. Science has advanced so much. Can doctors, the oncologist, we have hardly very few oncologists. ଆମ ଦେଶରେ ଏତିକି oncologist trained ନାହାନ୍ତି. That's why I'm very about cancer. You have to find an oncologist to talk to him. ତାଙ୍କ ପାଖରେ time ନାହିଁ. But a general practitioner will not be guiding you. ଏତେ ଭଲ guide କରିପାରିବେନି cancer. Cancer is a very highly specialized subject. There are two things that are going to be the future in medicine. ଏଇ hall ରେ discuss ହେଇଥିଲା. One is transplants. Second is oncology. Transplants ପଢିବ, oncology ପଢିବ. ଏଇ ଦୁଇଟା field will be very far. ଏଇ hall ରେ discuss ହେଇଥିଲା ସେଟା. So transplants, you understand, renal transplant order सब होची. Oncology will be also a very specialized field in the coming years. So ସେଇଠି କ'ଣ ହଉଛି, death is not the final answer. If it can be, medicines are coming. Sir को ଯେନ୍ତା କହୁଥିଲେ, stage 1. The earlier you detect, the earlier the awareness is there. Then we are not a health-seeking behavior. I might be a postgraduate, but I don't have that health-seeking behavior. ମୁଁ ଯାଇକି ମୋର ହେଇଗଲାଣି 60 ଏଜ୍, ମୁଁ ଗୋଟେ କୋଲୋନୋସ୍କୋପି କରିବି, I will not do it. କାହିଁ ସେ ଗୋଟେ ପୁରେଇବା ଗୋଟେ କ'ଣ ଦରକାର କଲେ ମୋତେ କିଛି ସିମ୍ପଟମ୍ ନାହିଁ କହିବି. We don't have that kind of health-seeking behavior. Smoking, ଆରେ ହେଲେ ଦେଖାଯିବ କ'ଣ ହେବ କି ଅସୁବିଧା ନାହିଁ. We'll see what will happen. The risk behavior we would like to take. So we as individuals, we are not very health conscious or health-seeking behavior. That will take time. So I will not get into the second part. So sir was telling stage 1, stage 2. He also mentioned stage 4 we can be able to treat him, give him some years of life. I like it. Today I got a biopsy detected. Biopsy hegala. The first question the family, the patient will ask, what will he ask? In general, कौन पचार पे से? How many years? Today I am going to the palliative care unit. When I go to the round से गलाल का मैं देखते हूँ, the only thing they are having an eye contact, से मैं आखिरों में से आँखों देखो जी, आप कहते दिन सर. That's the only question that is going into his mind. So as soon as sir tells that you have this, sir, how many days? I have to plan. I like it. So palliative care is meaning by palliative care, we are not into the curative. Curative is his field. Palliation is to elevate his, palliation means it comes from a Latin word, to elevate. ताको symptom था. Cancer has got a lot of symptom burden. खाली cancer तो है गले बन, ताको pain तो, हाँ, acute pain वाला असुविधा नहीं. He will have chronic pain. Should a patient suffer from chronic pain? Chronic pain में मुझे pregnancy वाले गोटे pain था हुए कि नहीं माँ डेलीवरी छुआ था लाड़ू गोटे पेन था सेटा गोटे दिन केते भाई से लेबर टाइम रे से पेन था हुए से पेन ता यदि छुआ थाउ न थाउ से पेन ता होथबो शुड इट बी अलाउड हां दैट इज कॉल्ड chronic pain मु थरे छुआ जन्म कर देछि छुआ टाइम जब नो दैट पेन विल बी देयर acute pain very painful but should it be allowed to गोटे थरे छुआ देला पर should the pain continue it happens in cancer okay cancer रे कोन the pain is not useful for the patient hello भागटा कामी देला इति तुमको ये सामान्य strict your pain. It's an acute pain, you have to remove the hand. It's a protective. It's called a protective pain. But in cancer pain, there is no protection. It's only painful for the patient. So that is very important. That's a very important symptom management in the cancer patient. So it is called pain management. That is a palliation rate. We are looking at the symptom burden. When sir has discharged the patient, or at the time of diagnosis also the palliation get in. With the Amazon center, it is more of a hospice center. So what happens? Sir he started the treatment, either chemotherapy, radiotherapy, or a mix of chemotherapy, radiotherapy, adjuvant जोड़ा कहूଥିଲେ, or immunotherapy, this सब देले for 2-3 years he had remission. 2-3 years माने चाहो किसी तो भल था से, तार किसी नहीं. After 3 years he again seen the recurrence of the cancer. So पुनी बड़ी चले, this time with a more vigorously it is ready. Should the patient be allowed? Doctor रहता से कोई I can't help you much now. Is the doctor's role over? If you are the patient or I am the patient, is the you will look at the doctor that he will tell his role is over. Doctor role sorry gala ki nahi sorry gala. You feel that doctor has a role to it. Nahi. Dr. Majumdar will not be left. Sir, jahan bhi achhe karan tu kichi. I cannot stand this pain. I cannot get vomiting every day. I cannot nausea. Mo uthi बांती वाले लागुची मोर बॉडी पूरा इचिंग होची डू समथिंग फॉर मी आई वांट व्हाट ही वांट्स get rid of all these symptoms. That is called comfort. Comfort is to give the patient comfort is called the palliative care. First step, to give comfort to the patient. I will not be able to do much about the disease. Disease ta patne se body bo. I will not be able to do beyond certain point. I will not be able to at present medical standards. at your technology and everything is available at present medically, I will not be able to do much after certain time. Like, it is progressing, it has spread to sargent metastasized, very advanced stage cancer. Should we leave him like that? We cannot leave. He has to be given that comfort. Okay. That comfort, what we are using, we will do the symptomatic management. So we call it palliative care. So at the time of diagnosis, certain times sir diagnose karibe कि you have this thing, but you are vertebrae टिके आपण treatment radiation टिके पछर दे देबे आपण को bone pain टा कमी जाई परियो. So palliative radiation, palliative chemotherapy also is come. मैं पूरा ट्रीट तो करि परिबि नि, किछि सिम्पटम बर्डन आपण ट्यूमर बर्डन तो कमे देबी, टिके केमोथेरापी दे देला हबो सेटा पडुछबो किंतु टिके कमी आसो किछ दिन पे भल लागियो. Palliative. So at the point of diagnosis, the palliative treatment also starts. Curative treatment to chalchi at the earlier time at beginning day, curative will be very high, palliative component will be less. As the curative component decreases, our treatment is a patient ka kichi besi farak padini, the palliative component will go high, curative will come down. That is about the patient. Now the family is also distressed. For a family that distressed achi, with the cancer patient, financial loss is there. Everywhere you cannot treat. Moedi Kalahandi rochi, nola Koraput rochi. DHH number basic kama hi parivan patient. I have to come to AIIMS Bhubaneswar, nola Hachari hospital asi audio. Diagnosis pa histopathology pa sabu hela pare. Treatment part nowadays we are referring mane sir lekhi de debe ei protocol ta follow karo DHH se kari paribo ame. But we cannot manage that diagnosis investigation part guda protocol decide kariya bhi it has to come to the cancer centers. So sete dura asibo kebe. Asigi etu sabu nei kiri. And if you have gone to AIIMS, it is very difficult. It's very difficult to get a this thing appointment also. AIIMS Bhubaneswar. Similarly, Acharya, we need some more cancer hospitals. They will grow as the population cancer base hospital will be body chali. That is there. That will be there. But the financial loss joda thai tankara, the financial loss is big. Like asiba, jiba, kharcho, pocket out of pocket expenditure. Treatment may be free. Out of pocket expenditure will be very high. All this the families are totally shattered. There is no one to talk to the family. Doctor has no time to talk to the family. He will see the patient or will talk to the family. He will not be able to talk to the family. Palliative care, we have counselors. It's a multi-designed process. You have doctors, you have counselors, you have physiotherapists, and then you have social work to compare. And you have spiritual also. Spiritual people, because health is a component of all these components. Health is a component. So all these people became one team. What a team this is called the palliative team. Palliative team is not only doctors. At that point of time, about treatment we are not concerned very much about curative portion. We are only concerned about the comfort of the patient, to take care of the family, to take care of his spiritual needs, and we get into link with all NGOs. Financial support, the social part also will be so good. So this kind of center, luckily you have at Bhubaneswar. It is one of the best in India. And this comes from Bangalore. Bangalore Hospice Center achi. And luckily in Bhubaneswar we have this hospice center at InfoCity 2. It's a very good building, 50 acres and very well built. 131 is the bed strength. And people from Asanti City Rohanti, where you can come, where we give palliative care to or hospice care to the patients who are not able to manage those symptoms at home. The symptoms body symptom burden that they cannot be managed at wound it will be communicating. Tube nasogastric tube there will be no space. All these things problems will be there with advanced cancers. So that is taken care at the hospice care. Now the hospice care, the general belief is when we tell we are into the hospice care, what is the belief? What is the general belief? General belief is okay. But it has been now proven. It has now been proven, advanced studies have been done, that if you improve the quality of life of the patient, even after there was no treatment, his life is prolonged. It's a scientific data. Okay, so it is very important that how do you want to die? So because we don't discuss about death. Usually, we will talk about birth, the happy birthday parties and all these things, but we'll never discuss about death. But we are because scared of death. Cancer called death. That is what is here. So, but we need to talk about death also to the family. Family also. Even in our setup, he has come after stage 4. Stage 4 the patient does not know the prognosis of his disease. The family knows that he is going to die. The family has not told the patient case study that you are going to die within a short period because there is no further treatment. They have not told the patient. So this kind of collusion, technically we call it about collusion. This kind of collusion is always there between the patient, family. So we have to ask patient को कहबू ना नहीं कहबू, family को कहबू कि नहीं कहबू, है कि नहीं? For a 5-year child, the child will not know any prognosis तक कौन ही चीज़ जान नहीं, है कि नहीं? The family knows it. So how does the child will hope? There was one child, sir, recently. Our immediate care in the palliative care was, she is a 14-year-old girl. She had multiple metastasis. She had the whole body. She was very bad shape. So we were only giving little bit of oxygen. Her only immediate goal was February 11th is today's her birthday. February 11th is her birthday. She just wanted to go to her house and celebrate the birthday. And abdomen was totally distended. Then finally we told whatever happens. If we distension goes, pani bhar kar dala dekhiye jaha hoga. We got the this thing fluid out, tapping karikiri. She went home. She got discharged. She went home to celebrate. We know she is very sick. She will come back or she will not come back also, we don't know. But that immediate goal has been done. Was immediate goal of her going to the house and celebrating her birthday has been fulfilled because of the hospice care or the palliative care, because this is a team working out there. In a hospital, if you go to AIIMS, they will not be whether tor February 11 birthday achi ki nahi achi. They're so busy actually. They will not be able to manage all these kinds. So this is a time where you have a center. So this center is spread in 50 kilometers and it is very well designed. It has been designed by a Bangalore team. Any time you have, you come and see the hospice center. You will be interacting. Will not allow you to go to the patient side, but you can see everything. What is happening there, what is not happening there. So we are lucky that Bhubaneswar Imtagote Center achi. Please, you spread the word among your friends that there is a palliative center, Bagchi Karunashraya Palliative Center. It is not Bagchi Sankara, it is Bagchi Karunashraya Palliative Center. When we don't have to do anything with the Bagchi Sankara Hospital. It's a separate entity. We are a separate entity. Bagchi Karunashraya Palliative Center. Okay. This center where we give the hospice care or the palliative care. There are many cultural things. Ama Odisha, if there is no time limit for, even if there is a death happening, they can go to Swargadwara anytime. So you need to be 24 hours of death certificate. These are all things. Grief, bereavement, what happens to after death, all things are taken care of in a hospice care or a palliative care. Ultimate thing is you give a dignified death. How do you want? You imagine. So ICU रे भर्ती है एपटे गोटे ट्यूब एपटे गोटे ट्यूब एपटे गोटे ट्यूब एपटे गोटे सब 5टा ट्यूब लगी सब पड़ी रही. Do you want to die like this or you want to die your people holding your hand?